Let's go ahead and get started because I want to give our speaker as much time as possible. But before we get into today's presentation, I am so excited to kick off Good Dog's fourth annual health symposium. I cannot believe we've been doing this for 4 years now. It is truly one of the highlights of the year for us at Good Dog, and it's really how we're able to give back to our community by providing these free and virtual opportunities for any breeder, any dog lover to come and learn some really cutting edge information from canine health experts, no matter where you are located in the country, even sometimes the world. I know we get some international breeders joining these as well. We just want to make sure that canine health information is accessible to everyone. So that's why these are always free and they're virtual. And again, it's just our way of giving back to our community and helping us all raise the bar on our programs together so that we can have a healthier future for our dogs, which is what it's all about. So to start this month-long event, we have Dr. Carla Barstow joining us to present on Breeding Healthy Dogs, Part 1. We were just talking before we went live about how so many breeders just request this topic, and I can see based on registrations why this is so popular. So we are so excited to have this discussion today. So this is part 1 of a 2-part discussion. Dr. Barstow is going to be sharing tips and tricks to having the best possible breeding outcomes, what diagnostic tests and supplements are needed, and what can be skipped, and also discussing the myths and facts surrounding breeding. So we're really excited for the discussion today. We want to extend a big thank you to our friends at Purina Pro Plan for sponsoring this event and helping us bring it to life. We could not do it without them, and we are so grateful to work with them on this event as always. And of course, as with all of our live events, during the Q&A segment of the presentation, we're going to prioritize those previously submitted questions. And then we're going to do our best to get to the ones that come in live through the Q&A chat. So feel free to drop questions in throughout the presentation, and we'll do our best to answer those as well. But we are going to prioritize some of the ones that we already received. And then last thing I'll mention, this is exciting and this is very unique to the symposium. We're trying something a bit new this year, and we're going to actually be posting a quiz after each session that you can take to test your knowledge on what you just learned. And then if you complete all 4 quizzes, so one after each of our sessions at the end of the symposium, you're going to be automatically eligible to win prizes from our partners like Purina, Snuggle Puppy, Revival, and more. So we have really exciting prizes to give out to our community at the end of October. And we're going to announce those winners at the end of the month. So this is just going to be the first quiz of 4. So each one's going to follow each presentation. But head over to our Facebook group a little bit after this where we will post that quiz. And then it's also going to be linked in this Friday's newsletter. So you'll have many opportunities to get that quiz, submit your answers, and then hopefully become eligible to win some exciting prizes. So we're really excited to add that fun element to this year's symposium. And before I pass things over to Dr. Barstow, I want to quickly share a little more information about Good Dog for anyone who is joining us. I know a lot of people extended the invitation to their breeding groups, their communities, so there might be people here who have no idea who we are. So I wanted to take a minute to introduce ourselves. Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for dog breeders, educating the public through events just like this, and promoting canine health and responsible dog ownership. We are a secure online community that's created just for responsible dog breeders to connect with serious, quality, good dog applicants to find forever homes for your puppies. We use the power of technology to help our good breeders level up their breeding programs, providing them with tools like our secure payment system to protect you from scams, and our best-in-class software to post your available litters, start connecting with good dog applicants. And we also have, of course, a number of free educational resources and health-related discounts to help your breeding programs thrive. So if any of that sounds interesting to you, and hopefully it does, we would love to invite you to apply to join our community at gooddog.com/join, which we just dropped in the chat now. And if you have any questions about joining our community, you can always email us at breederteam@gooddog.com, and someone will happily help you. And I want to just share quickly a little more about Dr. Barstow before I pass things over to her. I know everyone's like, Nicole, stop talking. We're not here for you. Dr. Barstow is a diplomat of the American College of Theriogenology. She also is an active member of the Society for Theriogenology. Dr. Barstow practices in small animal medicine in Lakeland, Florida, and is the only reproductive specialist serving the greater Tampa, Florida area. In her practice, Dr. Barstow works with dog breeders to breed healthier dogs, and she is a longtime breeder of Samoyeds, one of my favorite dogs, and participates in dog shows. So with that, Dr. Barstow, I pass things over to you to get the presentation started.
Perfect. All right. Thank you so much, everybody, for joining us this afternoon or morning, depending on where you're located in the country. Today, we're going to be talking about a very important topic that affects not just the dogs that we love, but the future of their well-being. So we want to breed healthier dogs. And as dog lovers, we want all of our pets to be healthy, and live long lives. And so for that to happen, we need to ensure that we're doing things that's promoting their health, not just for now, but for generations to come. So kind of a little bit, as Nicole mentioned about me, I am from Florida. Granted, our beaches don't currently look like that. Avid hockey fan, and love the snow a little bit. My dog liked it more than I did. And my claim to fame is being able to assist with a litter of 19 puppies from some Borbles while I was at Auburn University doing my residency. So when we think about breeding dogs, there's lots of things that come to mind, and it can be a little bit confusing as to where to start when we're choosing our good breeding practices. So we're going to break this down a little bit. As Nicole mentioned, this is a two-part series. Today, we're going to be talking a little bit about some of our health testing and clearances, vaccinations, the age at which we should be breeding, nutrition, heartworm and flea medications, and supplements, which are kind of near and dear to my heart. So starting with some of our health testing. So why do we do genetic testing? Basically, it allows us to calculate a risk assessment to minimize diseases and to identify our carriers for certain diseases. The question that I get asked so often is, can I breed my carrier? However, the real question is the welfare of that future puppy that's produced or the parent that is a carrier, are those going to be affected? Now, most of the time when we're dealing with a carrier status, the puppies aren't going to be affected. And so then it is actually safe to keep this animal in the breeding population to help keep up the greater diversity of our gene pool. What about if we're using an affected dog? Now, this is going to depend on the disease. However, most diseases where a dog is affected, they're not really going to be good breeding candidates because it is going to affect the mom or the stud dog. However, in like Stargardts that we see in our labs, it's a late onset disease. So sometimes excluding those affected dogs can minimize our gene pool, and kind of going forward with that. So we want to increase our genetic diversity while decreasing our disease prevalence. So we need to ask ourselves, how can we combine our animals in such a way that we're not excluding some of our affected and carrier animals, that no diseased puppies are born? And the way we're going to do this is we're going to limit the number of breedings that a certain male is going to be doing, because we have this popular sire syndrome, which can actually create a genetic bottleneck and minimize our genetic diversity. And we want to combine animals wisely instead of excluding some of our carrier animals. Other reasons that we'll do genetic testing includes the ability to give certain medications. So some of our breeds are sensitive because they have the MDR gene to ivermectin and other medications out there. Other people like to know, some pet parents want to know the genetic makeup of their pet. As shown here, this is my dog Ruger from years ago. He is my DNA tested Afghan hound. Granted, this DNA test was done in 2006. As you can see from that curly tail, that's definitely Afghan there. Don't know what else he was mixed with, but some people like to be able to do these to see what we've got going on. Now, when we're doing some of these panel tests, we're looking at these, and breeders frequently run these to identify if the dog is healthy. However, when we look at the wide variety of tests that are actually included in these, the majority of these are actually not relevant to your breed. And they even have a disclaimer at the top that says the research has not yet linked these conditions with dogs similar in your breed. And so we have to be very careful when we see some dogs that come back as, carrier or affected for some of these tests that we're doing when we're doing these panel tests. So Out of the 196 tests that were run, only 2 were truly relevant to my particular dog at that time. And so while I really love these panel tests, we have to be careful in thinking that this is an end all be all for our dogs. But the good thing about these is that you can share these results directly to OFA. So that goes right to OFA, and I don't have to do another test. Everything's taken care of. And it gives us just kind of sometimes a clearer picture as to what's going on with them. Now, if the DNA test says that they are affected, does this mean that your pet is going to have clinical signs and actually get the disease? Diseases like exercise-induced collapse is what is a reduced penetrance disease, meaning that some animals are going to show clinical signs and some won't. And then degenerative myelopathy, this is an age-related reduced penetrance. So we're going to see this in some of our older animals. And so just because a DNA test says that they are related does not mean that they will develop clinical signs. Obviously, if you have something that comes up and you're concerned about it, please discuss these results with your reproductive veterinarian. That's what we're here for, to help with the genetic counseling of your pets. All right. And the other little caveat I do have to mention is that just because there is an available DNA test does not mean that it is a valid DNA test. Okay. There is no regulatory oversight for animal DNA testing companies in the US. So if you want to set up a shop in your garage and start selling DNA tests, there's absolutely nothing stopping you. So do be careful when you're picking the companies and making sure that they are a reputable company with it. So we discussed our genetic tests. So that's like our blood tests looking at their genes. What about the different phenotypes? So we're going to briefly talk. So obviously there's lots of different phenotypic tests. These are the things that we see when we're looking at an animal, like hip dysplasia, elbow dysplasia, cardiac thyroid, those kinds of things. So the OFA, which was originally Orthopedic Foundation, however, they're more than just hips and elbows. They are a phenomenal database that maintains all of this information. And the OFA works with the breed's parent clubs and recommends the basic health screenings required for breeding stock. So as shown on the screen here, this is the breeding stock for my breed for the Samoyeds. And so if the dog does all of the testing that is recommended by the breed parent club, they will get a chick number. Now, what this means is they did the tests. The tests don't have to be normal, but you will get your chick number as long as you do the tests and the records or the results are public record. And that's the big part, is because all of these records being out there for the public to see helps us responsible breeders make more informed breeding decisions. The database that OFA is, they generate so much information when we're looking at our dogs. And so we can take our individual dog, and this is from a vertical pedigree, and this is just for hips. So I can look at my individual dog, I can look at his siblings, and I can look at his offspring. At this point, he doesn't have any puppies that are old enough for OFA testing yet. But then I can look at his parents and see, am I picking a potential good stud dog for my breeding program? So I can see the depth of his pedigree, but I also get to see the breadth of it. I get to see, is this a good candidate for my breeding program? And that to me is so important. And I love the OFA's ability to have this database at our fingertips for us. Now, obviously, for some of our non-AKC breeds, you can still submit all of your tests to the OFA database. They will absolutely maintain that for you. And I do actually have to say that I'm actually really impressed with some of our non-AKC breed members. So they actually do have requirements that they hold their own breeders and standards to as well, to make sure that these other dogs are actually breeding healthy animals as well. And so that makes me extremely happy to see that. All right. So we talked about what things that we want to do before considering to breed. So is this animal going to be something I want to keep in breeding stock? Now we're going to talk a little bit about things at the time of breeding. I'm not going to be discussing progesterone timing. Progesterone timing is essential. Absolutely. It's great stuff. That was already covered in a previous seminar. by Good Dog. I'm sure you can find that on their website. So definitely watch that if you haven't yet, because progesterone timing is vital. We're going to kind of move on to things that haven't been discussed yet. So vaginal cultures. All right. So before we discuss this, this is a huge soapbox of mine. We're going to review a little bit of anatomy first. So trigger warning for some people. All right, so this is a reproductive tract for our female dog here, okay? So as we can see, the opening to the vagina, so our vulva here, is directly under the anus, okay? It is open to the outside world. The vagina is not meant to be sterile in any way, shape, or form, okay? It is not how this works. So we know we have normal bacteria living in our reproductive tract, just how it works. It's kind of like we have normal bacteria that lives in our GI tract. It helps to keep the bad infections at bay. So we want this bacteria there. And that's kind of an important thing, for these animals. A recent study that was just done, published earlier this year, using a huge number of vaginal samples, 96% of them had bacterial growth. Okay. And so for all of those stud dogs that have required you to have had, a vaginal culture as a pre-breeding thing, how many of those boys also had a culture done? Because I'm going to tell you right now, the boys are just as dirty as the girls are. So vaginal cultures as part of a routine pre-breeding management in an apparently healthy bitch is an absolute waste of time and money. Please don't do them. Now, that's not to say that cultures aren't important. If I have a bitch who's coming to me, or even a male, and I've got purulent, nasty debris, and it has a foul odor, and on cytology, I've got lots of inflammation, so I've got lots of white blood cells, and I've got lots of bacteria, then yes, absolutely, a culture is warranted. But if you came to me for breeding management with a female pouring pus out of her vagina, I'm going to tell you to skip this heat cycle. Because when we give antibiotics, we kind of ruin the natural biome of the body. And so we're going to kill off both the good and the bad bacteria. And so we're actually potentially going to be setting up some of these bitches for future infections that are actually going to be, worse for them in the long run. End of soapbox on that one. All right, so the other big thing that I do like to discuss is brucellosis or brucella. Okay, so this is transmitted by any bodily fluid. Okay, inhalation, ingestion of contaminant thinnings. It can actually be transmitted venereally as an STD. This is something that is extremely important to make sure that we are testing for this. Some animals may not show any clinical signs, and that's the really scary part about that. Sometimes we just see some infertility. Females are going to have some late-term abortion, and then males can have some swollen testicles or again, no signs at all. Currently, some of the statistics that I read, up to 8.6 of positive cases, depending on the area of the country. We seem to have a little bit more in the South than we do other places. Now, when we're dealing with brucella, this is a zoonotic disease. This means that this is contagious to you and I. It's not like super high on the contagious list, but it is absolutely up there. It has been proven to be transmitted to kennel workers, to lab technicians when they're trying to culture this. It is reportable in certain states. It is reportable in the state of Florida. It is reportable in the state of Georgia. It is not reportable in the state of Alabama. So those are kind of things to kind of keep in mind. When we're doing treatment, it's usually unrewarding. If you are a licensed kennel in the state of Georgia, it is an automatic euthanasia. You do not get the option to treat this animal because of the zoonotic potential for this disease. We do consider neutering them because neutering and spaying them actually reduces the amount of shedding that they're going to be doing. They're going to be on lifelong antibiotics, but we're not really ever curing them of this disease. This is something they are going to have for life. So this is something that we want to make sure that we test before every breeding. So females, every time they come into heat, and we're going to be breeding them on that cycle. So basically every 6 months. Same thing with the males. Obviously, sometimes if we've got an active male who's doing a lot of breeding, then making sure that he's tested every 6 months as well. those are kind of the big things that I want to discuss. Those are my major things. All right, so now vaccines. These are kind of another big thing that we do worry about with our dogs. So when do we need to vaccinate? So for our December and parvo combination vaccines, these are considered modified live vaccines. They are attenuated, so they're not going to actually cause disease in the animal, but they may cause some inflammation. And so when we've got a bitch that we're going to be coming up due, oh, you know what? Hey, she's going to be coming into heat around November. She's due for her vaccines in like December. Maybe in September is when I want to be going ahead and boostering those vaccines. Okay. I want to make sure that she's protected as best as possible. Now, they did do a study to try to see if we can confer more immunity to the puppies by actually vaccinating closer to the heat cycle before she had the puppies, but it didn't work like they wanted it to. Obviously, if we kind of forget and things get busy and oh my gosh, I forgot that her vaccines are going to be due. Obviously, these are things that we can skip, but obviously it's not ideal. Now, when we're dealing with our rabies vaccine, this is non-negotiable. Rabies is a killed virus, which means the mom is not going to be getting any part of disease. It's going to cause less inflammation in the body than some of our modified lives will. This has to be given. So if your dog is not current on a rabies vaccine, I will basically give this up to the day of breeding. I try not to give it after breeding, but if I have an animal that is pregnant and hasn't gotten the vaccine and is absolutely necessary, we can definitely safely give this while they're pregnant should we need to. We do try to minimize that as much as possible though. Other vaccines, leptospirosis, bordetella, flu, Lyme, depending on the part of the country that you're in. Obviously, same thing, the rules are going to apply with like the December parvo a couple of months before the cycle, if at all possible. Obviously, these are more lifestyle vaccines anyways, so these are things that we can probably skip because we're probably not going to be going to the dog shows with the animals that we've been just bred. We want to kind of keep them home and away from everybody else, so they're going to have less exposure to these diseases. All right, so when do we actually want to breed our dogs? This is kind of the age-old question that we get a lot. So for our female dogs, I like them to be at least 18 months of age. So this is so when we are going to be skeletally mature and also mentally mature. Obviously, we can't do our final clearances with the OFA until they're at 2 years of age. So that's something we have to take into effect. However, sometimes having some prelims, we know that they're good, and we've got that 18 months, then we're kind of okay to go ahead and consider them breeding. And there was actually a study that showed that bitches actually have larger litters the older they are. So breeding them on that first and second heat cycle where we may have smaller litters or potentially setting them up for joint issues. They're not mentally mature for this in any way, shape, or form. And so waiting until they're a little bit older, we're going to get better litter sizes out of our girls. Boys, since they don't have to actually bear the burden of carrying the litter, we can actually do that basically anytime after they hit puberty. So anytime after a year of age. However, the younger the male, the semen quality may not be as good until they're after 2 years of age. And same thing, we can't get final clearances on them until after they're 2 years old. Now, the nutrition. This is kind of a big one. This is near and dear to my heart with food and now. So when we're looking at our body condition score, okay, so we have these numbers. What exactly do these numbers mean? So I want everybody to make a fist. Oop, I'm kind of blurry there. So when you can see your knuckles and you can see those are basically the ribs. Right? So that is too thin. Now, if you make your palm flat, you can feel the ribs under a thin layer of fat. So that is ideal. Now we're going to flip our palm over. Can't feel the bones in my palm. That's too fat. Okay. So that's how you can feel your dog compared to you and know where they kind of sit in this. So when we have a dog that has a low body condition score, we know that they may not consume enough calories to support herself nor to be able to support the puppies. Now, this is different, I know, for certain breeds. Some of our sight hounds, I expect them to be a little bit on the skinnier side. Some of my extreme working Malinois, I know they're going to be a little bit on the skinny side, but they still usually eat enough food to maintain a decent muscle mass. So there's a little bit of a difference between an overly thin dog because it's not eating well versus a, in great shape, working athletic. But we do know that the lack of nutrition can cause decreased birth weights in our puppies with an increased neonatal mortality rate and decreased conception. So there's a good chance she may not get pregnant. On the flip side, in our overly chunky dogs, again, they may not get pregnant. And that's a huge thing. You're spending a lot of money and a lot of time in this breeding endeavor. We want to make sure that they're at a great body condition before we're doing this. Overfeeding them also while they're pregnant can actually lead to larger puppies in utero, which can then also lead to a dystocia because you've got bigger puppies than what she was meant to have. And also, the uterus is a muscle. And so when we put down fat because we're eating too many calories, we put down fat in all of our muscles, including the uterus, which can lead to decreased contractility when we go into labor, which can lead to more C-sections. So how do we avoid this? We want to ensure that they're at an ideal body weight before breeding. And if this means that we're going to skip a cycle and we're going to come back in 6 months and reassess, then absolutely, that's what we're going to do. While they're pregnant, we want to feed them an energy-dense diet, something that is easily digestible, something that they're able to get good nutrition from. But we're not going to increase our calorie intake until the last 2 to 3 weeks of pregnancy. And it's kind of vital to remember because we don't want to feed them too many calories too soon. And we're going to feed them a highly digestible diet and multiple small meals throughout the day, especially as we get later in gestation, because they're going to be, not having as much room since those puppies and all of that are going to be in there. So what are we feeding them? So you want to feed them a good quality, I do prefer a kibble diet with grains. Again, a slight little soapbox. So the grain-free diets we know can cause heart disease in our dogs. But in addition to that, a lot of the grain-free diets are actually made with a lot of legumes, which is soy, which can act like an estrogen, which can affect our cycles as well. So I do try to stay away from those. I do like to avoid raw diets during the breeding and lactation process. Raw diets can absolutely be fed and fed well. But when we're dealing with a pregnant dog, we have seen decreased conception rates and we have seen abortions due to salmonella. Because it's not the dog, the adult dog that gets sick. It's our immunocompromised people that get sick, children, elderly, people on certain medications like steroids, and the pregnant women, because that puppy or that baby in utero can't protect itself and doesn't have a good enough immune system to fight off the bacteria that's in that raw diet, sort of like mom can't. She's got that ability to do that. The baby's not so much. Fun little study that I came across where they actually took salmonella and put it into some different bowls to see, how we clean them and how much salmonella we can actually recover from them. So even going through the dishwasher, that actually surprised me. I really expected that number to be significantly lower. But after doing a really good scrub with soap, and then soaking it in a 10% bleach solution for 10 to 15 minutes in a stainless steel bowl, you still got 33% of those bowls came back positive for salmonella. So this is something to kind of keep in mind if you've got young children in your household and you're feeding raw diets, and children are playing with the dog bowls and those kinds of things. This is something that can definitely be, transmitted to them. All right, so if you want to avoid, I'm going to actually put the disclaimer in there. I do not get kickbacks from food in any way, shape, or form. I wish I did, but I don't. I recommend certain food companies because I absolutely believe in what they provide. So our big companies out there, obviously, but if you want to look at different avenues, Rain Pet Nutrition is actually one of my favorites that I'm really starting to enjoy their foods. They have different foods. So they have a lot of pork-based ones. They have alligator. They have rabbits. They have kangaroo. So different protein sources with minimal ingredients. A lot of those diets are actually meant for our allergy dogs, but there's not a lot of added extra stuff to it. If you want to be able to cook for your dog and do a home cooked meal, nothing wrong with that. It's so easy to hit the macros on those sides, but we can definitely have our macronutrients off. So there's a company called Balance It, basically where you can go on and you can pick your protein and you can pick your carbohydrate source and you can kind of basically make a complete and balanced meal for your dog, but it's also going to include a supplemental bag of the micronutrients that that animal needs to making sure that we're not missing anything, and that they are getting a complete and balanced meal like kibble-based diets are. Heartworm and flea prevention. So I live in Florida, heartworm and flea capital of the world. We love our parasites here in Florida. So there are lots of safe medications that are out there, proven safe for our breeding and lactating animals. Not to say that there aren't other medications out there that might potentially be safe, but we don't have the studies to prove that they are safe. And so dogs should be on heartworm prevention year round. For those of you people listening in from states that have seasons, unlike Florida, and you get snow on the ground for a couple of months out of the year, heartworm disease has actually been found in all 50 states. So definitely do still recommend keeping dogs on heartworm prevention year round. With that, and then for flea medications, Bravecto has been proven safe. I know there's a lot of chatter out there in regards to Bravecto. If you actually read the study with the Bravecto, they used a highly inbred population of dogs, so that already had a known set of defects, and then they gave them the Bravecto while they were pregnant nursing, and then they still had the same amount of defects at the end of the study. There wasn't an increase in defects. So yes, they had defects, but it's basically the same beginning of the study. So I do like Bravecto. If you would rather not use that, you can always look into using Frontline or Advantage. However, we're knowing that those aren't as efficacious as they used to be. All right, supplements, the reason I think everybody is here. So there's tons of different products out on the market. And how do you know which one you need to choose, which one's a good one, which one's actually going to do what you want it to do, what the label says it's going to do for you? So we're going to go a little bit of a definition here. So a nutraceutical is basically a food or a part of a food that provides a medical or health benefit, including prevention and or treatment of a disease. Now, nutraceuticals can be marketed to you and I, to our dogs, without the FDA proving that these medications are safe and effective. Okay, that's actually the scary part. These companies can make these medications and they don't have to prove that they are safe and effective. And what the bottle says on the label doesn't have to agree with what's in the bottle, because there's no oversight to the majority of these companies. A couple of years ago, a study was done that actually compared basically the price in dollars per dose of 32 different glucosamine chondroitin sulfate. These are all human products. And so they wanted to know basically at a certain price point, were the higher price ones actually more efficacious? So 90% label, so 90% of the drug was actually in the bottle in only 5 of the cases. So out of 32 products out on the market, only 5 of them had at least 90% product of what the label said that it did. And that's actually kind of the scary point, is because there's so many of these other medications that you can be buying and you don't know which dot they are. Obviously, you do sometimes get what you pay for. So some of these cheaper medications may not necessarily be worth that, but even some of our higher end products, they didn't really fare any better either. So that's kind of something definitely you want to keep in mind when you're picking your products. So as you know, that then what it says on the bottle doesn't have to be in there. So how do you know you're doing a good product? And that's where this beautiful little yellow label mask C comes into play. Okay. So in order for a company to have this label on them, they have to pass comprehensive third-party audits every 2 years. They have to maintain an ongoing compliance with their facilities. They have to do annual continuing education, and they have to pass random independent testing of their products to ensure that they're actually meeting their label claims. So if you were ever going to buy a supplement, go through your drug cabinets, look at everything, you want it to have that yellow label on there. That way you were getting your money's worth out of these products. And that's the important part. If you're going to put your money into something, put it into something that might actually do some good with your air. All right. Now some individual medications. So calcium. All right. So if we supplement the animal during pregnancy, now this is during pregnancy, we can have better milk production kind of at the end of the pregnancy. And actually, supplementation during pregnancy can lead to dystocia or potentially even low calcium levels during lactation. If the bitch is fed a complete and balanced diet, she does not need to be supplemented calcium during pregnancy. So when we give excess calcium, our body stops making it, we have all of these production systems that are online to pull calcium from extra storage areas in the body. The body is inherently lazy. If I don't have to do the work, I'm not going to do the work. So why would I do that? You're giving me excess calcium the entire time that I'm pregnant. I'm going to shut those systems down because those systems require energy to keep them online. So I'm going to be lazy. I'm going to do that. Those people, they're going on vacation. They're at the beach currently. But calcium is absolutely essential for muscle contractions. And when do we have tons of muscle contractions? When we are actually in labor. And it needs to be mobilized very quickly. And so the calcium from that day that they got is going to be used up really quickly and can lead to dystocias because those systems aren't online like they need to be. Now, this isn't to say that we don't ever give calcium. Absolutely. Once that first puppy is out and that first puppy's on the ground, then go ahead. You can start your calcium to give her some extra calcium, to give her that extra boost and all of that once we've got those puppies coming out, but not while she's pregnant. She gets everything she needs from her diet. All right, folic acid. This is also another topic that we get a lot of in questions and concerns about. So we supplement ourselves when we are pregnant to prevent cleft palates in humans because we know that folic acid absolutely helps prevent neural tube defects like cleft palates, spinal bifida, and those kinds of things. And the reason that humans require supplementation is because we do not eat a complete and balanced diet. We go to McDonald's, we go to Taco Bell, we really enjoy our food, and we don't actually we have all of these multivitamins that we can go to CVS and Walgreens and buy, but we don't actually take them on a daily basis like we're supposed to. And we kind of eat what we want. And so that is why humans absolutely have to be supplemented because we don't eat good. Dogs, if they're on a complete and balanced diet, everything they need is in there. They've done a couple of different studies. There was one study that looked at pugs and chihuahuas. The data wasn't ideal and it was a very small sample size, but they did note did have a decreased incidence of some cleft palates in dogs after they were supplemented with the folic acids. There was a really giant study actually using the guide dogs for the blind, using their breeding population. So it was a much more robust study looking at Goldens and Labradors, and they found no significant difference in that study. Now, on the flip side, the Nova Scotia Duck Tolling Retriever actually has a genetic defect that causes cleft palates. So no amount of folic acid is ever going to be able to fix that. And so folic acid is considered a B vitamin. So this one is kind of a benign one. So if it makes you happy to give it, you are absolutely welcome to give it. But everything they truly need is in their diet if they are on a good quality kibble diet. All right, fenugreek. So fenugreek is in the same family as clover. It actually acts like an estrogen and it actually does work to increase milk production. There are some studies where it looks at them assisting it with male infertility. However, in the male, it actually acts more like an anabolic steroid. And there's a whole reason that bodybuilders have really small testicles and actually don't produce children. So don't give it to boys. But for females during lactation, if you need to have some little assistance after puppies are born, because this does actually contain calcium, you can. Just keep in mind that we don't have great reports in humans, but I've used it in several of our breeding bitches when they haven't been able to be here or they need to pick something over a weekend. It does work pretty good, but it can decrease the bitch's blood sugar. So we want to monitor that and make sure that, she's doing okay there. It can slow blood clotting. So if we've got a bitch that had a giant litter, this may not be our go-to because she's got a lot of placental sites, so she may have some increased bleeding, lotion, all of that stuff. And it's supposed to taste really bad. I can't say I've ever tried it, but that's what the literature says. So we do actually have some really good proven lactation medications. Most of you are probably familiar with metoclopramide or Reglan. So this medication is a weak agonist. So it binds to the receptors kind of a little bit, not completely, but it does a decent job of being able to help regulate that so we can make our prolactin go up higher so we can make more milk. Domperidone is actually what I use in my clinic. This is actually an equine medication that is a very strong binding to those receptors so we can actually get good milk production. Other drugs that I have on here, acepromazine. So if you have that nervous bitch, she's a little more unsure of herself. Sometimes they don't have good milk let down. And so giving them sometimes a little bit of a sedative just to kind of take off that edge to make them a little bit less stressed. Sometimes acepromazine can be very beneficial there. And obviously oxytocin, well, oxytocin doesn't make the milk. That's where that Reglan and domperidone come in to help them make milk. Oxytocin is vital for milk let down. But if you've got the puppies that are suckling and you're getting a good nursing reflex, they're probably she's probably producing enough oxytocin on her own. Okay. Carnitine. This is actually an amino acid that is made in the brain, the liver, the kidneys. It's basically, you might find it in some diet pills because it actually helps to turn fat into energy. We use it in the treatment of dilated cardiomyopathy in dogs and in humans. And there is obviously a product out on the market to enhance sperm motility. We have seen some good studies in humans, in infertile men, because it helps with energy production in the sperm to help them swim better, those kinds of things. So we've had some pretty decent studies in some humans where they've had improved conception rates, those kinds of things. However, dog studies are lacking. We don't have any great studies that said that, yes, this absolutely did help. One of the studies I did find actually had dogs that were, the semen was collected and then the L-carnitine was actually added directly to the ejaculate. And they did notice that the dogs froze semen a lot better. So, but that's still kind of a couple of years off. So it's kind of out there in the works. May not hurt, may not help though either. All right, probiotics. I absolutely love. GI biome actually is a host to so much in our body and our immune system, and keeping this as healthy as possible is actually one of the best things that we can do for our body. And so probiotics are live active cultures. There's lots of different varieties there, and it's used to treat a whole host of actual different things, using for diarrhea, helping with epilepsy control, juvenile vaginitis. So earlier when I talked about the vaginal cultures and the dog having nasty purulent vaginal discharge, if it's a puppy and she has green ooey gooey vaginal discharge, I'm actually going to put you on a probiotic because that is actually going to be more beneficial for your dog over an antibiotic. It may not get good penetration to that particular area anyways. All of these products that are listed actually have really great studies showing that they are effective in multiple different varieties. Obviously, the Fortiflora is kind of our diarrhea. Proviable has been used for lots of different other things. And the Visbiome is another really great one, but it does have to stay refrigerated, so it's a little harder to play with. But all of these do carry the NASC label, so do highly recommend any or all of them to help with whatever you need for your animals. All right. Omega-3 fatty acids. Love these. I did my master's program on these, so these are, my favorites. So what fatty acids do animals need? Because obviously animals can't make them all. So they do have some essential fatty acids that are obtained through the diet. So animals really need EPA and DHA. Those are the two that they need for dogs and cats. Cats also have another amino acid or fatty acid that they need from their diet, but it is also in their diets for them. EPA and DHA, as I said, so these are our marine fatty acids. So for people that are taking like ALA, which is the plant-based omega-3, it's not well converted to the EPA and DHA in both dogs and humans. So I'm really sorry to all the vegans and vegetarians out there. If you need to be on a fish or like an omega-3 fatty acid supplement, I do highly recommend that you be on something that is actually EPA and DHA. So our marine fatty acids, they're absolutely going to be the best thing. We don't have great studies in dogs. We have actually more studies in in humans and in horses. But we do know for our pregnant dogs, essential fatty acids are absolutely needed for pregnancy and lactation, and a deficiency in this can lead to poor placental development and small litter sizes. And so we want our bitches while they're pregnant to be getting about 45 to 65 milligrams per kilogram. If you don't know how to do the math, please talk to your vet. They can absolutely help you with that. I'll have an example a little bit later on one of the slides that goes over that. So when we're talking about our omega fatty acids, they're in a couple of different classes. So we have some that are in our green-lipped mussel, which is also known as Perna caniculus. So you guys have probably all seen these products out on the market. And we do believe that it's the omega-3 fatty acid part of the green-lipped mussel, which actually helps with our joints. It absolutely helps with joints because it is anti-inflammatory by nature. With the particular products that are shown, we have anecdotal reports of improved semen quality. There are no published studies using any of these medications. If these are one of these that you wanted to try because of the green lip mussel, I highly recommend the U Move, because again, they carry that AST label on them to make sure that you are actually getting a good product for your pet. So if we're going to just go with some straight fish oil, so basically omega-3 fatty acids protect the cell membrane. They actually get in there to make it more flexible and better able to withstand cold shock. So this is going to help our motility when we're shipping semen across the country and when we're freezing semen. Okay, so that's kind of where we want this, but this helps dogs that have lower motility. This doesn't help dogs that are already doing well. So if you've already got a dog that freezes well, that ships well, this isn't going to make him any better. But when he starts to decrease a little bit, definitely would highly recommend, to get on those. The Nordic Naturals actually makes a really good soft gel, and then Nutrimint's Well-Actin 3TA is a liquid fish oil. And so if you're just starting your animals on these, and so based on that dose that I showed you earlier for our pregnant dogs, for about a, 60-ish pound dog, the omega-3 capsules that you can buy, whether the Nordic Naturals or any of the other ones out there, they usually say, like the fish oil, it says it's about 1,000 milligrams per capsule. However, of that fish oil, only about 250 milligrams is the EPA and the DHA that we care about. And so to reach an appropriate dose for most animals, you've got to give them about 6 capsules. That's actually a lot sometimes to get into a dog. Sometimes they hate it, they don't like the taste. Whereas our liquid omega-3 fatty acid has about 1,200 milligrams per teaspoon. So you can usually get away with 1 or 2 teaspoons depending on the size of your dog. So just some different options that you can consider for them there. So talking about all of these supplements, which ones am I really actually going to ever give my dog? And honestly, if your dog is on a complete imbalanced diet, good kibble, you don't have to give them anything. There's really no need to add in extra things. You're spending money on stuff that may or may not help for them. And sometimes when we add these things, we can actually create an unbalanced diet for our dogs. However, if you do want to give them something, I highly recommend omega-3 fatty acids and probiotics. Those are the things that are going to absolutely help us making sure that our animals are living as healthy as possible. If there's other supplements that you have questions about, please, of course, talk to your veterinarian. They're going to be the ones that are going to be able to make the best recommendations for your particular animal. So kind of to wrap it all up today, so we obviously want to ensure that our supplements are safe and effective. So we've got that nice label on them. They're safe for pregnant and lactation. And unfortunately, sometimes we don't have great studies on a lot of these medications. And our reproductive success is going to require a combination of both health, fertility, or pedigree, and proper nutrition. Those are vital to making sure that we're going to have our best possible outcomes for this. And so maximizing these things is going to help us to reach our reproductive performance. Thank you guys so very much for having me today. Thank you to Good Dog. Thank you to Purina. My clinic email is listed there. If you guys want to shoot us an email, obviously I don't have a relationship with a lot of you, so they're just going to be very general answers that you might get from me. And if there's other things that I didn't necessarily discuss, it's probably going to be covered in part 2 later this month, where we actually go a little bit more in depth on some of the things for the active breeding process.
Amazing. Thank you so much for that presentation. I also love this cupcake photo at the end. That's amazing.
Absolutely. I wish I could take credit for that one, but I can't.
It's very creative. I do love it. Amazing. So we do have a bunch of previously submitted questions that I was hoping we could go through, and definitely let me know if I'm spoiling part two for any reason and we can just skip
Absolutely,
those,
absolutely.
leave something to be desired. Okay, so first question is what might contribute to a false pregnancy and how common are they?
Okay, so false pregnancy is probably going to be touching a little bit more on that at the next one, which is, I believe, is October 23rd. So please stay tuned for that. But false pregnancy is just, it's hormones, unfortunately. So our breeding bitches, when they cycle, they do the same thing whether they're pregnant or not. And that is different from every other species out there. Like cats, when they come into heat, they go out of heat. They come into heat, they go out of heat. Dogs, once they go through a heat cycle and they ovulate, that progesterone stays high, regardless if they're pregnant or not. And that is what leads to our false pregnancy sign. So if we look at our wolves in the wild, the alpha female is the only one that breeds, but sometimes she needs help raising those puppies. And that's where having all of those other females, dormitory effect, cycling together, that can then potentially even lactate without being pregnant to help her raise those puppies. And so it's kind of a throwback. And, I can't give you numbers on how common it is. And sometimes we see it, sometimes we don't, but it does definitely exist just because hormones.
Awesome. Thank you for going over that. Another question we have is someone who's wondering if you can give the benefits and drawbacks to AI, TCI, and live cover.
And so AI, TCI, all of that absolutely will be covered in my next talk. So I will save that for next time.
Okay, amazing. Something to look forward to.
Mhm.
Okay, another question is I have several females that either skip or have a silent heat. Do you have any idea why this might happen?
So silent heats are usually more common in our younger animals. So we can see those a lot as they're trying to, figure themselves out. So they go through their free seed cycle, around 6 months of age. It's kind of like going back to being a teenager again. And, we're not regular right away. And it takes the body a little while to figure things out. Obviously, we want to always make sure that, we've got a dog that's over 2 years of age before I'm ever really going to worry about heat cycle issues. So I know that she's had a chance to fully go through puberty. She's had a chance to fully be, figure out what's going on. Um, and then we're going to start diving into some other things, other problems that might be causing that. We do definitely look at diet and nutrition. Those are huge for our animals. Any medications, anything that the owner themselves might be on. A lot of our aging population is actually on topical hormonal creams, and they actually have you put it on your inside arm. And then you lay in bed with your dog. And so your dog can be exposed to these hormones as well, which absolutely can affect how the dog then reacts to everything. So,
All right, interesting. Okay, we just have time for, I think, one last question. This is a pretty large question, so hopefully we can answer this. Is it better to breed back to back or skip a heat?
actually, that is a phenomenal question. So, the uterus is meant to be pregnant. The uterus serves no other purpose in the dog's body other than to be pregnant. And so I'm of the mindset that if the bitch is in good body conditions, she, had her puppies, she bounced back nicely, she's in good body shape, she looks great. Let's breed her back to back to back. Let's get the litters we want out of her, and then go ahead and get her spayed. So we're not dealing with other infections and things like that, that we'll kind of go into a little more depth in the next talk. But definitely, as long as they're in good body shape, there's no reason not to go ahead and breed them. Now, that being said, I know that does go against the code of ethics of some breed clubs that are out there, but sometimes they're not vets. So definitely something to kind of keep in mind with all.
That's really interesting. I actually did not know that. Amazing. I think that was the last question we have so far. One thing I do want to call out, because I did see some questions about this in the chat, is that this was all recorded and it's going to be available on our feed as soon as we end our live stream. So you can go back and watch, share it with people, take more notes, whatever it may be. So this recording will be up for as long as you need it. So I just wanted to mention that to everybody. And I feel like the Q&A section was a really good segue to remind everyone that this is a two-part discussion, and we are going to be bringing Dr. Barstow back at the end of the month to finish up this discussion. It sounds like there are a lot of things people are wondering about that are going to be covered actually in the next presentation. So we are eagerly awaiting that. I believe that is October 23rd, but I will double check because there are so many events this month to keep track of. Speaking of events, we have the next event in our symposium next week, and that's going to be with Dr. Fran Smith, who has done a number of presentations for us. I know our community loves her. She's going to be presenting on neonatal and infant health, birth to 6 weeks. Someone on our team thought we would clarify that this is about puppies for anyone who thought that might be a misleading title, and it's about children. It's about puppies. So that will be on Wednesday, October 9th at 1 p.m. Eastern, right back here on Facebook Live. And if you have not registered for that already, we will drop the link to that in the chat right now so you can do so. And it'll work just like this. It'll be a Facebook Live, about an hour with a Q&A at the end. So thank you all for joining us for the first session of our 4th annual health symposium. Dr. Barstow, thank you so much for being here. I saw a lot of people in the chat saying that this is their favorite discussion we've had yet so far this year. So
Okay.
just thought I'd let you know that people love this. So I'm really
No,
glad.
good. Glad that I can help people. I'm glad, so glad to be here. And I look forward to speaking to you guys later on this month.
Amazing. Yes, I'm so glad we're bringing you back for a part 2. And I can tell that our community is as well. Thank you all for joining us today. And if you are not yet a member of our community, you can apply to join at gooddog.com/join. And we'll see you right back here next Wednesday at 1 o'clock Eastern for our next symposium session. Bye, everyone. Thank you so much.